And we are back, energized and excited, and releasing our 30th episode on the third season of Connecting the Dots podcast with me, Juliet. We start 2026 strong. We start with an African science giant, a Cameroonian by birth, but living and working in Nigeria and the US. In 2013 December, the Ebola virus ignited a crisis in West Africa. The outbreak claimed over 11,000 lives. Yet, when it reached the shores of Nigeria, a nation of nearly 200 million people, something remarkable happened. The outbreak was declared over in just 42 days, with only 8 lives lost. The secret was a radically fast response. Diagnose, then act. This lesson in speed became a blueprint. In 2020, as COVID-19 swept the globe, our guest sequenced the virus's first African variant within 48 hours of its arrival. A continent braced for catastrophic toll instead saw a far lower number of deaths. The evidence is clear. Speed saves lives. The time between identifying a threat and mobilizing against it is directly measured in human lives. The critical question now is how to build that speed, that readiness, into our global health fabric before the next threat or future pandemic emerges. Our guest has been described as a die-hard scientist and a force of nature. Professor Happi's career is a chronicle of crucial firsts, among many diagnosing Nigeria's first case of Ebola and years later sequencing the first African COVID-19 genome in just 48 hours. We don't know if it's possible to quantify the number of lives that have been saved through Happi's work of identifying viruses before they turn into major public health crises. What we do know is his relentless work has helped numerous countries in preventing and managing outbreaks of Lassa fever, Mpox, Marburg, and many others, in addition to building capacity of scientists and frontline healthcare workers across Africa. It seems like he's only getting started. In 2025, he was named one of Time's 100 most influential people and could not be more excited to have him on our first episode of 2026. I almost said 2025. Welcome to the podcast, Professor Happi.
Thank you. Thank you very much, Judith, and nice to be here.
I want us to start on a light note. Congratulations on being or named as Times 100 and winning the MacArthur Grant. I hear that's a lot of money, about US 100 million, and we'll talk a little bit about that in the global financing cut and how maybe that has affected you. How did you celebrate? You know, we read that your wife jokingly refers to your laptop as your second wife. So how did you celebrate? And I hope that you managed to take some rest this holiday season.
Yes, I did take some holidays. I think for the first time in many, many years, I spent 2 weeks without having access to my laptop. And that was a big deal in my family because at least my children could see me without my laptop, without working, without being on video conferences. And I think it was a good time. And I want to believe that going forward, I think I should be doing this more often.
Yeah. How did you celebrate being named Times 100?
Well, I don't know whether I'm not sure I did celebrate it. I think I just attended the ceremony like other people. And again, I just want to say I was surprised that again, it's not something that I was expecting. It's not something that I worked for. It just happened. So I was caught by surprise by the Time magazine team when they invited me in a meeting, and then I thought we were going to talk science and a research project, but then they announced to me that I was one of the uh, 100 most influential people in 2025. But I was surprised because I told them I don't read Time magazine. I don't subscribe to it. So I don't know how I ended up in your yeah. And then a few months later, they made me again another Time magazine 100 most influential people in health. But again, I'm not sure. I'm not certain. I don't think to be honest with you, I've not had time to celebrate. But there's so much to be done. But
Yeah.
then I want to say that I'm grateful and I'm thankful for the recognition. I think it's not personal. I think I need to give credit to my colleagues who have worked with me over the years, people who have who have supported me, and then I've been in the trenches working. I think it's all about the commitment of the team working with me, and I think I don't want to take credit for it. I think they deserve more credit than I do, in all this work.
No, I mean, congratulations, Professor Christian Happi. That's his major achievement. It's funny when you say you don't read the Times, but at least it's taken you away from the scientific community into the public sphere, where people get to see the achievements that you've been able to deliver on the last couple of years. I want to double back a little bit and go back to your childhood. As a child, there were two pivotal moments that set you on your career path. How do those moments still influence your vision and drive today?
Well, I think those two pivotal moments are the ones that are, I mean, set my career path and then they're still driving me up to now. So I think, yes, my mom is still alive. She still reminded me, not far from December that, listen, you said you were going to find a cure for malaria. You still haven't found a cure for malaria. My
Yeah.
old mom still told me about this. But I said, listen, we're still working on it. It's not that easy. And I mean, she was just teasing me, but I want to say that she was very proud of the fact that my childhood vision and dream actually came to fruition, and in her lifetime she could see this happening. But I just want to say that those are the things driving me. What keep me awake at night is just the fact that I'm worried about hearing a disease outbreak somewhere, killing children especially and women so especially. So I think those are the things keeping me awake, and I think it's not over until it's over. I think we still have a lot to do, and especially as a continent in Africa, I think we have way more to do than others. And not because because the problems are first of all ours, and then we need to leverage these problems to find solution, not only for the continent but actually to contribute to solution to mankind, because the pathogens actually are the single existential threat to humans. So, and we need to work extremely hard. And then I think um, in the creation, God bless Africa with pathogens, and I think they are not just they are blessings, and then in disguise they are not challenges. And I think the signal there is that he probably did that because he believed that Africans should be able to leverage that to find solution. Not only to address those problems, but actually to also save the world.
And you've been finding these solutions using genomic sequencing. And let's double into the pandemic preparedness and prevention. And could you explain perhaps to our listeners what genomic sequencing means and how it changes the game in regarding to preparing for our own response to our own outbreaks here on the continent?
Well, I would say that, first of all, what is a pandemic and then what is prepared? A pandemic is something that starts with a small outbreak somewhere in a very small place where people tend not to know. And then from that small outbreak, it becomes an epidemic. And from that epidemic, it can spread across the globe to become a pandemic. But then to prevent a pandemic, you need to have the ability to prevent outbreaks. And if you prevent outbreaks, then you're going to prevent epidemic and then therefore pandemics.
Pandemic.
And that is a unique opportunity that we do have in Africa, is because 70% of pathogens that do have pandemic potentials or outbreak potentials or epidemic potentials are in Africa. So, and I always say, the other thing that I say is that you cannot control a disease that you cannot diagnose and you cannot detect. And that's where genomic comes in, where we have now the ability to use advanced and ultra genomic sequencing platforms to characterize pathogens that are circulating in our own environment, detect those that we know and those that we don't know, make predictions to know those that could have, that could become that could create epidemic or disease outbreaks, and then develop countermeasures, against them. So, and then that's what genomics is helping us to do things very much more faster and much more better than we used to do, 20, 30 years ago. So, and that has become the game changer. As you mentioned in your introduction, there are two major things that you need, or I would say three major things that you need to beat an epidemic or to beat an outbreak. First is the speed, second is accuracy, third is cost. And then all of those things, when you bring them together, you not only beat epidemics, but you also save lives, and in a very critical way. We've demonstrated this over and over and over. And I think with, and I'm sure you'll get to that. And that's exactly what the Mercator Foundation has given us resources to say, yes, we demonstrated this, and then it is a model that never fails. And then now we want to scale this thing up, not only to take it to an African level, but also to make it like a global model that can be used to help, the world respond to epidemics in a way that wasn't done before.
Yeah, I mean it's very interesting. Even looking at Lassa fever, which is one of those outbreaks that you've been able to, the Lassa virus, sorry, that you've been able to sequence. I was shocked to read, in our research on you and your profile, I was shocked to read like for 50 years this virus went undiagnosed. So I mean, what does that mean when patients are presenting at hospitals and they're not getting the right care? What does that look like?
Well, it looks like the answer. It looks like when you don't have the ability to diagnose, then 90% of the people present with the hospital with the disease died. But when we actually developed the first diagnosis after about 37 or 40 years, what happened is that we reversed that trend from 90% case fatality rate to 23.6% case fatality rate. It just shows you how powerful the introduction of the diagnostics in the very rural community can reverse the trend and save. I mean, and change the way the paradigm and then save life in a very tremendous way. So apart from that, then you also understand that in that kind of environment, that a small rural hospital in the middle of nowhere in Nigeria that nobody talked about became a center of excellence for diagnosis and the management of a disease of global importance. It actually shows how a small intervention, creating diagnostics quick, detecting fast, enable you to save life and then to prevent people dying. And in the same hospital, just to talk about healthcare workers, by the time we deploy the diagnostics, or before we deploy the diagnostics, they used to lose at least 5 medical personnel every year. But
Wow.
since we deploy the diagnostics in that medical facilities and across that single medical facility, I'm just taking that use case, they haven't lost a single medical personnel in the past 15 years. So that gives you a sense of what some of these interventions are doing.
And that's a good highlight because, most of the times when we talk about lives saved, I think people always are under the impression that it's the community members. But here we are also talking about healthcare workers who are providing the care to the community. I want to go back to the Ebola outbreak and the response. You tell an incredible story about hearing about the first case of Ebola in Nigeria. Could you take us back to that night and how the early sequencing helped the Nigerian government respond to that outbreak?
Well, I want to say that it's a long story, but I'll cut it short. It's an interesting thing because it's the way God works. Around that time, we have given birth to our last child, which is my son. He was having some medical issues, but for some reason, I couldn't get a ticket to take him back to the US where he was born to see his pediatrician. And
Yeah.
then one night, which is exactly on July 20th, I got a call, and that call that you don't want to hear, you don't want to have a very chilling call around like 8:40 p.m. And then I was told by one of my mentors who said, "Look, hey, there is a suspected case in Lagos, but we really do not know. The case has been around for a few days, but then all the tests, are proving negative. We believe that it could be he was a Liberian, but then visiting. Then it could be Ebola." And he told me that, look, the only person that will give us that will believe is you. So what do you think you can do? And I took that responsibility that night, not having all the facilities, to leave my house at about 8:49 to be more precise, and then to go to the lab. And of course, I knew that there was that possibility that I couldn't make it back because I didn't have a lab that was super equipped. So it was two small rooms with a small laminar flow and no air conditioning and
Wow.
nothing. So I took some change. I had some clothes on me, and I took some changing clothes, and then I told my wife, "Well, I need to go on and address this problem." And she said, "Yes, I know. This is what you've always wanted to do." And I said, "Listen, it's very possible that I will not make it back because I'm going to deal with the beast. And I said, look, if I don't make it back, if I don't make it back home, if I die along this way, I think it will be better for a few of us to die and then save many more people." And she said, "I hope, and I'm sure you would." And that was one of my assistants who joined me, and then we spent the night working, and then we made that diagnosis within hours and confirmed them by morning when we were telling Nigerian public health authorities about, Ebola. And then this is how, with that, we were able to isolate a particular patient, prevent him from traveling, to then be in contact with many more people to transmit the disease. And that became the point where we started really testing uh, 10 hundreds of cases every day and giving the result in every time.
Wow.
And then and that was, as I mentioned, putting speed and accuracy. As we did that, we also sequenced within days, and then we were able to actually demonstrate that we had Ebola, and then not only Ebola, but it was a particular, the Zaire strain. And
Train.
we're sharing the data in real time with Nigerian public health authorities. And that's how Nigeria was able to identify pockets of transmission, to contain them, and that's how Nigeria was able to contain this in 42 days with only 20 cases and 8 dead. So it was speed, it was accuracy, it was also the fact that we're using methods and costs that were pretty affordable.
I mean, this Time magazine influential cover, you should have been receiving this way earlier. 2025 was late. We're talking about speed here, and speed when you're, detecting viruses. I think we should have detected you as an African science leader way in advance. But Christian, a quick question before I go into the African government and the Nigerian government and the support they accorded to you. Who took your son to the hospital? Because you got the message, randomly one night. Was your son okay? Was he dealt with okay?
For some strange reason, I was in the midst of this thing. My son was doing okay, but eventually, maybe 2 months later, in the midst of this battle I was in, working 24/7 virtually. But eventually, my son was okay. I think he turned out to be okay.
Okay, that's good to hear. So changing the narrative of African governments, how did policymakers support your work during the Ebola and COVID outbreaks, and what lessons can be learned by other governments on the continent and the rest of the world?
No, but I will say that, I will give a lot of credit to the Nigerian government. I think I think I've seen consistently Nigerian ministers of health and then the government of Nigeria being so able to adopt novel technologies and absorb technologies and innovation in a way that is not done elsewhere. And
Mhm.
I think that is really key. That was something that was very key to, to containing that Ebola outbreak in Nigeria. But then there was also what I call a national mobilization. The private sector got into it. Everybody was hands on deck. And you could see a whole country standing, leadership coming together, and they will all work as one people. And then eventually, you know, it's um it proved to be very powerful. It is the same thing that we saw during COVID in 2020. The whole of Africa, it's very interesting when we say that Africans don't collaborate, they don't talk. But I think when the tips are down, and then when they know that their life or the leadership in Africa realize that their life is at stake, they can
Mhm.
collaborate in a way that is very powerful. We saw that during COVID. We saw African scientists and African policymakers and African leadership collaborating, partnering, coordinating their effort to the response. And we could see Africa beating the first wave, of COVID that was killing people across the global north. I mean, in a very terrible way. So, and I think, it is again that whole idea of absorbing technology, because as we sequenced the virus, the COVID in 2020, most African countries were ready to absorb the technology. We shared that with everybody on the continent. They took it, they ran with it. We were sharing information, comparing data, and then you could see Africa, leading. That's exactly the leadership that we need. We led the world on how to
Right.
respond to this outbreak, and I wish we could do this in not only when we have emergencies, but actually leading in normal time and then leading in every aspect, of our life on the continent, collaborating, coordinating our efforts, sharing information. I mean, those are things that we did during COVID, and that worked.
In your mind, what are three things maybe that you saw during the Ebola crisis or the pandemic, the Ebola crisis, sorry, and then the COVID pandemic, for governments and for leadership that you would say, okay, we need to do one, two, three things?
The first thing is I would say is believing in scientists. I saw, I can tell you one of the major reasons why Nigeria defeated and beat Ebola that way, because the Nigerian government believe in the natural science. Because when we were doing this work, a lot of the non-governmental organization, international organization, I don't want to name them here, and
Yeah.
regional health organization, they were busy doubting the data, doubting the results, saying, oh no, we need to confirm this in X lab overseas and blah, blah, blah. And then the government told them that, look, our best scientists is telling us that this is it. Well, why should we argue? Why should we dispute the fact? So while we are going with what, they are telling us. And I remember the minister of health said, look, I had the health of the Nigerian people. I'm responsible for it and I make the decisions. You're not going to be the one telling me I don't want to call the countries from the global north what to do, what not to do. And then those are the kind of decisions, believing in what you do, having trust in your scientists, and then not letting people create doubt in your mind, and that's exactly how we did. And then they showed that it worked. If we were sitting down, the difference between Nigeria and the other West African countries is this. See, Ebola started in Guinea. In Guinea, they had to send the sample to France to test. And this took about a month for them to get the
Oh,
result and send back into the country. Within that time, the disease is not stopping, it's transmitting.
right.
So, and by the time they are trying to respond, then it's often a bit late. But in the case of Nigeria, within hours, they knew. So you can imagine the difference between hours and then, days and weeks and almost a month in Guinea, for instance. I just want to give you that. And then just believe in the fact that, you can trust the science that you are doing. You can trust the scientists that you have, not a situation whereby people come from outside and then they say, hey, you know what, you don't know how to do this stuff. Let us show you how to do things. Of course, they
Mm.
don't understand how to. At times, most of them don't even understand the science better than you on the ground. And eventually, they would never admit to the fact that they were wrong in many ways. And then eventually, you know what, they turn around and they say your health system is not strong enough, it's not resilient and all of that. But COVID showed us that the health system in many places that we thought was resilient was not resilient.
Yeah.
So that's just the reality.
So, Christian, you've only mentioned one. I want two. The first one was trust your scientists.
Yeah, trust your scientists. Then number two is that you know what you need to build a community of practice. You need to build this community of practice, and you don't have to do it in the times of crisis. You do it in the times of peace. So
Yeah.
we had a network in Nigeria that was already working. We had a collaboration that was already existing. So we basically were just leveraging the network that we created in order to work. That is the second thing. And then the third thing is also the investment, made by government. I want to say, for instance, that at the time, one of the reasons why we were working nonstop and then we're making all those big differences in Nigeria is because we had resources. Resources were allocated to us to work without thinking behind. We had resources from the World Bank. And then the World Bank resources that we're getting were not gifts, they were loans from the Nigerian government, taken actually to respond to this kind of disease outbreaks. So you can see here investment, countries investing in themselves, in their health system. Number two, country actually just leveraging and building networks and systems in periods of peace. And then number three is believing in the local science and then believing in what the scientists can do and what the medical team and the clinical team can do on the ground. Those were things were very critical, I can tell you. And then once you build a community and you see people actually coming together to work to address the problem in a way that wasn't done before.
I love that. I really like that. And I want to take you to you building the Institute of Genomics and Global Health, formerly your organization called ASGID. What informed the choice to go to Redeemers University, a university in rural Nigeria, as opposed to even a bigger university or bigger institution like the University of Ibadan, where you studied?
Yeah, I think one thing is, first and foremost, is that if I wanted to build this institute in a place like University of Ibadan because of the politics and all this, it was not going to be possible. At times, going to small places that actually they see the value of the work that you do, is actually is better than to try to do it in places, especially where people see competition and then they don't see competition as something that could be healthy. So it becomes challenging. So I think clearly you'll see that a small institution like University of Redeemers University needed to have some recognition. They could see value into what we're doing, and then effectively they will give you all of the, they will give you all of the necessary support to build an institution like that one because they need visibility. An institution like University of Ibadan is probably a well-established institution, but probably even though they're living on old memories and old exploits, but I think they do not see the value of continuing making progress. So I think that is number one. Then the second thing is what Redeemers University is a private institution. I've worked at Harvard where you see, for instance, where it's the private sector. So the approach, and then to development is very different. So there is transparency, there is some level of accountability so that you don't often find in public institutions. So these were things, for instance, that I did consider, to do. And if you really building this in rural Nigeria, I think was very intentional. Why? Because to do the kind of work that we're doing, you have to be committed to the work. You have to believe into what you're doing. For a young man, for instance, to leave either Lagos or to leave Kigali or to leave Mombasa in
Nairobi.
Kenya or to leave Nairobi or
Right.
to leave Dakar or anywhere else, or Seychelles and come here and study, then that person should know exactly what he wants. There's no distraction. This is a place where when you're here, all you do is academic. You do your science work, you are committed, you are fully embedded in the science. And that's why we are so innovative. That's why we become the most innovative platform in Africa. Because even as a faculty, the young faculty that are coming from Harvard, from Oxford, from University of Cambridge and come here, all they do is to do the science. We build a community of scientists that live science, that breathe science, and then do everything. That's why we've shattered all the records. When people see this organization that is barely 10 years, they think that, oh
Yeah.
no, we could be 50 years. We've done what institutions, that have been around for 75 years, you're talking about the MRC, the Gambia, I don't want to, haven't done. And it's simply because it is a model where, I've had the opportunity to travel in my career and I've been to places like Cambridge, I've been to places like Oxford, I've been to places like Harvard, I've been to places like Stanford. in the outskirts of San Francisco and everything. And then you realize that, the reason why those people strive or those institutions strive is because they are what they call, academic city. I mean, they're the university cities. If you
Hmm.
go to Cambridge, for instance, and you take University of Cambridge, then the city of Cambridge doesn't exist. You go to, I mean, it is the same thing. If you go into Stanford and then you just look at around, if you take that university, that city around doesn't exist. So I think these are, what I call university cities. So these are cities built around campus, and they are often outside the environment where you have so much noise. Look at
Yeah.
University of Cambridge and then look at London. Cambridge is produces a huge number of Nobel laureates because they are far off from the hustle and bustle. Look at Oxford, look at Harvard, Cambridge, the Cambridge, Massachusetts, and everything. So it's basically just to say that having that institution in the middle of nowhere in rural Nigeria actually gave a unique opportunity for people to be focused. When a faculty comes there, he's focused. When a student comes there, he's focused. When a researcher comes there, he's focused. And that's what we need at this moment. We need focus to be transformational. We can be you can't be focused in the middle of noise. And that's the reason why we believe that, creating that there is actually showing that this is a model can change the game.
I mean, yours is a masterclass of establishing a knowledge hub, and I really love it. I love that description you've given. I've never thought about it that like that, and now you'll make me think about universities and knowledge bases very, very differently. Um, a bit about AskJID. Tell us what AskJID is, why the recent rebranding, and then very recently we discovered something beautiful called Sentinel. So I really want you to package all those three together.
Yeah, I want to say that SJ, there has been a vision, as you say, right from the beginning, I had a vision to eradicate disease. I grew up and then I saw that. And then SJ, that has always been a dream. So in my lab at Harvard, at the time I taught about when you hear about news from Africa, hearing about, disease outbreak at the time, killing here in Nigeria, in Kenya, in Uganda, you keep hearing disease outbreaks. You wonder what exactly, what is going on. And then here you are in pristine laboratories and facilities of Harvard, but yet you realize that you don't have that much power to actually address those problems. So what I did was basically just to say, okay, we're going to make a return, and then we're going to actually leverage the knowledge and skills, and then the platform that we have to actually transform, disease outbreak responses, use innovation, genomics and biotechnologies approaches, and use things now like information technology, AI, and all of these things now to respond to disease outbreak. And in order to do that, we needed to create a platform. So we created, and then, with resources from the US National Institute of Health, and then at the time the World Bank, were able to establish the African Center of Excellence for Genomics of Infectious Disease. Remember, very focused on infectious disease at the time when we started, and it was about bringing innovation in the space of infectious disease in order to, first of all, catalyze disease outbreak response, and then developing solution, diagnostics, vaccines, and then drugs. And we established ASGID with resources from the US NIH and you know and the World Bank. The idea at the time, I want to say, at the time when you mentioned Sentinel, Sentinel was an ideation. That ideation was how do we, in order to respond to disease outbreak, it was an ideation. We know speed, accuracy, cost. We save life and then we save resources. But we did not have the opportunity at the time to actually go from ideation to reality. But then when we got the resources from the World Bank and then from the NIH, it was actually resources to start practicalizing this ideation. And we were fortunate or unfortunate, I would say, Ebola stroke. And that was
Yeah.
when we demonstrated for the first time that all our
Amazing.
vision for Sentinel, or all our ideation that was behind the vision of Sentinel, we started demonstrating and practicalizing it. The first thing we did when we had the Ebola outbreak, I can tell you this story, was actually to transform the way we respond to public health emergencies. First, in the past, what used to happen when there is a public health emergency in Africa, the WHO will send some expert in quote. They will come. They will put Africans aside. They will take over the response. They will respond to the best of their ability. People will die. They will take the sample to some lab in Europe or in America. 2 years
Yeah.
later, they will tell you, oh, what caused that outbreak 2 years ago and that
Two
killed
years.
tens of thousands of people was
Yeah.
this particular virus we call COVID. Yet, when we were creating the whole idea of Sentinel at the time, it was an ideation. We were thinking about real-time response. So we brought to the fore when Ebola struck, it created an opportunity for us to transform the way you can respond to any epidemic. The first thing we did was actually to demonstrate that you could do real-time genomic sequencing. Instead of waiting for 2 years to characterize a pathogen, we're characterizing them in real time. Telling people in real time that what was causing this epidemic was this particular virus, and then this is its characteristic. That was the first thing we did. The second thing we did is that we created a platform where we actually openly share the data. And that was the second concept, open data sharing and open data access. The third thing we did was actually to the discovery of variants of concern. We observed that some variants, actually one particular variant appeared and took over and eventually was resulting in more death, disease and death. And then we were like, why is this variant so bad and then killing more people? We discovered mutations across the virus, and then across which we have like some specific mutation across some specific regions of the virus that was actually associated with increased transmissibility and also increased number of deaths. That was a discovery of variants of concern. That was never seen in a disease outbreak before. The fourth thing we did was, how do we translate genomic data into tools that can actually change the trajectory of the disease outbreak? We actually went from genomic data to create the very first rapid diagnostic test that was approved, Ebola rapid diagnostic test that was approved by the WHO and then the US FDA under emergency use authorization. The introduction of this test, that enabled people to get results within 5 minutes, changed the trajectory of the outbreak because it was going up. But by the time we introduced it, it cut it down because people could actually see in real time and respond in real time. So imagine, again, that is what speed and accuracy. Again, we're getting back to there, and then cost, because it was a test that was way cheaper than the PCR test that people were doing. Then the fifth thing we did was actually to demonstrate that it's like you say, you are building a plane while flying. That is using the resources to create, to train people in the middle of an epidemic on how to use innovation to respond, to the outbreak. So, and then if you see, discovery or introduction of real-time genomic sequencing, open data sharing, discovery of variants of concern, translational genomics, that is going from data to creating a product, which is a rapid diagnostic test, and then you're talking about building the local capacity during an outbreak. These were the 5 pillars that the world used to respond to COVID-19, in 2020. We actually pioneered and created all of this framework that I'm telling you in 2020. And that formed the basis of Sentinel. And one of the major reasons why Nigeria beat Ebola in 2014 is because we activated all these elements of Sentinel, in 2014. And that was the first time we were testing again in 2014. Sentinel, the ideation during an outbreak. And then I can tell you that we went further to repeat that during yellow fever outbreak, saving thousands of lives, during Marburg virus in Rwanda, during so many outbreaks that we've done across the continent. The good thing is it is consistent, as we do this. If you look at the Marburg outbreak in Rwanda in 2024, it happened in the city of Kigali. We worked with the Rwanda government, activated Sentinel, all of the elements of Sentinel. And guess what? We beat that outbreak in only 66 days. Case fatality rate, 20%. It is the documentation of Marburg is that the least case fatality rate of Marburg, of any Marburg outbreak, was 83%. That is average.
That's high, yeah.
But now we brought it down to 20%, and then it takes way longer. Actually, but in Rwanda, we did that in 60 days. So it's actually just to say that, it's demonstrated that it works. And that is how, through this program and through this system, a lot of institutions in the world have recognized that. The Kuwaiti government actually tracking this effort in 2021, actually recognized that you created a system, and then that's what we were awarded, the Kuwaiti, the ASUMIT, medal for the medal for the Africa Prize in Science. And I just want to say that, that's exactly, if you wanted to loop everything together, the innovation created on the continent, led by the continent, and then that has really transformed the way, disease outbreak are responded to. You can now see that for any outbreak anywhere in the world, these are the pillars that are being used to respond to outbreak, yet it was created from the continent.
Christian, that prize was very, very, very well deserved. And I'm so happy that you had that recognition, because even your impact at different sectors, whether it's policy engagement, whether it's a building of infrastructure, building of capacity and capability, in the continent. And laying that foundation for future pandemic when you are only thinking about Ebola. This was almost a decade before the COVID virus came in, was pivotal. I mean, we are wrapping up because, again, there's never enough time when you're having fun, and I could listen to you the entire afternoon. To the skeptics out there who, we hear about the outbreaks. Africa CDC tells us at any given time on the continent, there's more than 100 outbreaks, going about. And you've talked about Rwanda, for example, with Marburg. To skeptics out there who are saying there's nothing like a future pandemic, is there a future pandemic?
It is not if there will be a future pandemic, it is when there will be a future pandemic.
Wow.
And we should rather be prepared for that. That is the truth. There are just so many elements that are actually just could point toward the fact that it will happen. You have human migration. You have the fact that you have the interaction of human with nature. Human is getting more and more into, interacting with nature. And then and then with animal, you have climate change. You have a whole lot of things are happening that are actually preparing or that create, what I call conducive environment for pathogens that are existing in animals to jump into humans. Remember that that's where a lot is circulating, especially, in the animal world and in the environment. But then the interaction and the fact that human by nature, because we gradually and more we're encroaching, in the animal world and then encroaching on the environment. There are things that were very quiet in that environment that do not have access to us, but because we're encroaching, definitely we are indirectly exposing ourselves. But then you also have the fact that you have a lot of global. I would say climate change is actually just changing the ways we do a lot of things, and that also in a way creates some level of exposure, to of human to most of these pathogens. So it is, but then the point is, and the main reason when I say it is not a matter of if, but it is a matter of when, is the fact that after each pandemic, for instance, instead of remaining focused and then designing ways of stopping, preventing things from happening, we'll go back to status quo. We'll go back to business as usual. Remember, we just got out of COVID-19. But then if you come today and tell people to wear masks to prevent some things, people will look at you and say, are you okay? So, or that's just the truth. And then we've gone back to our normal behaviors. We are reckless in the way we do things. We are not, public health safety measures, we don't respect them anymore because, oh, well, it is gone, it is gone. But then it is just
not happening.
Yeah, hand washing is not happening the way it used to happen and all of that. So, and these are the things that actually can lead to risk and that are increasing our risk of epidemic. It's not only me. There are several studies out there. For instance, the Ellison Institute of Technologies actually has said that, in the next 10 years, there is really a potential to have another pandemic that will result in tens of millions of deaths if nothing's been done. Government put a lot of money out there during the epidemic and during the pandemic, but we are back at this point whereby, look, nobody's looking into that space. Nobody's putting resources there to do surveillance, and then because the surveillance level is very low, we don't know what is circulating below the radar. So it is very possible that what we'll see eventually is a situation where something circulates below the radar, and then at some point, boom, you just see that happening. We saw that with the resurgence of Mpox in Africa. Remember that we discovered the first cases of Mpox in Nigeria in 2017, 40 years after this was reported. But then our study, using genomic studies and genomic analysis, actually showed that there was a 5 years gap between when the Mpox virus was transmitted from animal to human and was circulating within critically. When I say critically, that is below the radar in human populations in Nigeria, for instance, for 5 years before we started seeing like some clinical cases. That's exactly what surveillance can prevent, to happen. We found that 5 years gap, you have the disease circulating nobody knew about, or virus circulating nobody knew about. So it's important that governments keep investing in in disease surveillance, in pathogen surveillance, so that we know what is circulating. We can now use novel method like artificial intelligence, and then use machine learning to actually even computing and predict how some of these viruses can jump from animals to human. So I think it's very important to make those investments, to actually make heavy investment into those space so that we can continue to do surveillance and prevent those outbreaks from happening or those pandemics from happening again.
I am very upset, Christian, that we don't have enough time because I really wanted to pick your brain, especially on funding. You've talked about resources, and our governments need to be pushed a lot more. And also to all those skeptics who say there's no future pandemic, I think we've had very clearly from Christian that it's not a matter of if, it's actually when. So as we close, what are you looking forward to, Christian, this year? And what are you excited about? I know you said there's a lot of work that still has to be done, but I'm hoping rest will be one of the things that you are looking forward to and building a great team around you.
Yeah, thank you. We're thinking about, start implementing the Sentinel program through the Mercator funding. We're really thinking about bringing some level of leadership in Africa so that Africans can start taking ownership of, these programs and become the drivers of innovation. So I think we believe that through this program, there's a huge opportunity for the continent to start really leading, and then leading properly, when it comes to, infectious disease research and innovation.
Anything to do with AI and Sentinel? We had some mamas somewhere.
Yes, there is a lot of AM Sentinel because we've learned over the years that data are very important. And with Sentinel, so what we're trying to do, we've created some very powerful dashboard. These are just reality. So where you actually get things in real time, then there's also showing on the dashboard in real time. And then now we want to use AI as a way to actually start making prediction. So the power behind Sentinel is the fact that we're bringing in together genomics, we're bringing in epidemiology, we're bringing in clinical science, we're bringing in laboratory medicine, but we're also bringing AI as a way now to actually leverage and use all those data to actually make predictions in a way that we can be ahead of the curve when it comes to epidemic response than to be behind the curve.
Very, very exciting stuff. We have plenty to look forward to this year. Thank you so much, Professor Happi, for joining us on this episode. And thank you for tuning in. Keep the conversation going on all our social media platforms. Remember to tag us at CTD Pod Africa on all platforms, YouTube, Instagram, LinkedIn, and TikTok. Tell us what you think we should leave behind in 2025 and what we should bring into the next year. As always, stay curious, be bold, and keep asking the question, why?